Hi, my name's Natalie. I am an employee at Nuffield Hospital in Brentwood, and I came to Mr Jetty's practice because I was having a lot of issues with my health, particularly my thyroid. I experienced a lot of weight loss, and other symptoms were excessive hunger, extreme tiredness, fatigue, irritability. The procedure I had specifically was called a partial thyroidectomy, which meant that I have my left thyroid lobe intact. So Mr Jetty explained that by leaving that would allow my body to have more than enough thyroid and other hormones to regulate my body. But my aftercare in outpatients was to have 2 blood tests to check the levels. He wanted to see whether that was the case, and if not, then he said simply we regulate that with medication. So after the healing process, I've had minimal scarring. I myself, it doesn't bother me, but I know it might bother some other men and women. But the incision is on the collar line. It healed very well. And to be honest, the only time that I do notice the scar is if I get a tan. There is a little bit of a white line. But it is very minimal, and it wasn't painful. When I was in hospital, it was just an overnight stay, and I had a drain, I had surgical clips, and the next morning when they were happy with my observations and I was feeling well enough, they took the clips out, placed a dressing across the incision, and I was to rest for 2 weeks. He was kind, he listened to my story and when my health concerns began, and looked at all the other tests that have been done. We talked about it together during that consultation. He was happy to go over all the options with me. At no point did I feel pressured to either not do anything or have the procedure. So he gave me time to think when I made the decision. It was a simple process, and all in all, Mr Jetty is a wonderful surgeon.